Well, if you're reading, most of the people that come after me on social media with comments about, well, how would we know to do this? And how would we know to do it? What are they pushing? They're pushing and they're trying to support symptom modification gimmicks. So it's hilarious that when I go check people's bios when they make comments, and the people that are in love with evidence-based practice and just can't practice with evidence-based practice are almost 100% always dry needling certified. Tell me where in the science-based practice model dry needling fits. It doesn't fit anywhere. You know why? Because we've already proven that dry needling is 100% bogus, that trigger points don't exist. So why are we even doing research on that? If we understand physiology and what's going on a physiological level, we know that we don't need dry needling. And we also don't need cupping, and we don't need K-tape, and we don't need stretching, and we don't need foam rolling, and we don't need massage. So all of the narratives that research is out there pushing is pushing you towards symptom modification bullshit. That's it. Keep you sucked into the broken medical model, keep you pushing the false narratives and telling your patients about all this fantastic research about if you do this and you do that and blah, blah, blah. Well, guess what? Research is nothing but biased exercises done by research people so they can push whatever narrative they believe in. So you can go find 10 research studies right now that tells you that dry needling is effective with this, that, and the other thing. But you can also find 10 more that will tell you that it's not effective with anything. And if you looked at, if you broke all of those down and you got down to physiology, it would tell you, why would you do this? This has nothing to do with physiology. Okay, so you can go make research say whatever you want it to say. And if you are wasting your time trying to figure out what the research is, you're spending your time doing that instead of spending your time thinking about the person, the patient that is right in front of you. There is no research project that has ever been done on the patient that is standing right in front of you, because they are unique, they are an individual, they have a unique set of it's not genealogy. Gosh, I'm gonna brain lock. So they have their own physiology, they have their own physiological demands, they have their own needs as far as their ADLs and their sporting activities, they have their own history. Genetics is what I was trying to figure out. They have their own genetics. So for me to say that I need to read a research study to evaluate and treat the patient that is standing in front of me tells me that I have absolutely no clue how to apply neuromuscular physiology, anatomy, biomechanics, critical thinking, root cause, all of the things that they should have taught you in school that they don't teach you. So the other thing that all of these people want to comment on is when I say, well, the problem is you don't understand how to apply science, like the things that I just mentioned, and they all come back, oh yes, every PT school teaches anatomy and physiology. Yes, correct. It teaches you the things that you will need to regurgitate on the boards, and if you ever go on Jeopardy, you'll be really good at answering questions about anatomy, physiology, biomechanics. But when it comes to applying those things to the person that's standing in front of you in the clinic, the reason why you're reading research is because you were never taught how to apply those skills, which if you knew that, you would not be wasting your time reading research. And it would be really easy to evaluate and go right into treatment, right into patient education, right into exercise progression, right into what you're gonna do the next visit with the patient that's standing right in front of you, rather than reading research about modalities and stretching and heat and ice and blah, 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 blah. So the other thing that people wanna come back on is, well, you know, you can't say that stretching is bad because stretching increases range of motion. And I say, every single research study that has been done since the beginning of time will tell you that stretching, foam rolling, massage, Theragun, all that stuff will increase passive range of motion. I get it 100%. Here's what you don't understand. What is the physiological mechanism that allows that to happen? And when you ask them that, they have no clue, because once again, they don't know how to apply neuromuscular physiology. When you force a muscle to relax with stretching, massage, foam rolling, whatever it is, soft tissue release, whatever, myofascial garbage, whatever, you're forcing inhibition, which increases range of motion because you just decrease muscle function, decrease strength, decrease stability, decreased ability to perform, increased recovery time, which is absolutely idiotic. Okay, so now see if that makes sense. Evidence-based practice, who created it, what was the reason they created it, what are the narratives that they've constructed to support it, and compare that to who created the food pyramid. What were the narratives? What were they trying to push? What were they trying to sell? What were they trying to trick people into doing? They're the exact same thing. So if you understand that the food pyramid was built on people trying to sell garbage and then sell that to medical clinicians that didn't know what the hell they were doing, because if you listen to people talk about when they went to med school, how much time they put into learning nutrition, it's pretty much the same amount of time that you as a physical therapist learned exercise. Huge problem, okay? So before you start to dig your heels in and protect all of the things that you were told, first figure out who told you that, what were the narratives, what was their purpose, who else is doing that stuff, and then see if that makes sense for you to keep passing that down the line to your patients and to other professionals. All right, so if you want more information on going deeper on all of that stuff and how it's easy to learn how to apply physiology, anatomy, biomechanics, and learn critical thinking and how to get to root cause, make sure you are in the 3-day free challenge on the 14th, 15th, and 16th of this month. I will put the link in the little caption down below. If you have questions, post your questions in the comments down below. Please, if you have questions and comments, post them there. Don't DM me, because I want people to see your questions and comments so we can stimulate more conversation, so this can get to the top of people's list of things that they want to address in 2005 when they start getting rid of all the crap that we should have gotten rid of a long time ago.